Yeah, we're yeah. All right, dog, we're live. Good
Yes.
morning, good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Tulola Bito, CEO, founder of Living Spring Family Medical Center. That's a mouthful. Where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. And we're here having discussions again on a Saturday morning, I might add, with the one and the only Dr. Nana Mireku. Thank you so much for being here, Doc. How are you?
I am fantastic. Thank you so much for inviting me. I am looking forward to this discussion today.
Awesome, awesome. And I love your energy. Awesome, awesome. All right. So I already mentioned your name, but for those who are watching, because we're talking about the topic, Doc, my child has a lot of scary food allergies. How do I help him or her navigate his or her world? And of course, we're having talks with a pediatric allergist. So please introduce yourself. Who are you and what do you do?
Wonderful. So my name is Dr. Mireku, and I'm a pediatric allergist, as you mentioned. And I'm extremely passionate about this space. I have two little kiddos who have life-threatening food allergies, who I found out after I became an allergist, not before I became an allergist. So I'm really excited to talk about how we can have a life with food allergies, how we can improve our life with food allergies, and really just live our best lives. I've been practicing in the DFW area for approximately 12 years, and this is my focus.
Oh wow. Wow, that's interesting that we didn't even know before, but you were in wow.
No,
That
God's
wow. God is good, man. Now, why do you do what you do? I mean, obviously you didn't do it because, yeah. So why do you do what you do?
Yeah, so I love children. So I always knew that I was going to be a pediatrician. And so I went, did my pediatric residency. But at the end, I had one more fellowship to go, one more semester to go. And I was like, let me just take some simple class. And it was the allergy one. And I literally fell in love. First of all, on my first day, I had swollen eyes, itchy nose, sneezing. And my mentor at the time, Dr. Nate, was like, let's put a skin test on you. And I literally lit up with everything. And I was fascinated with the field. I started allergy shots, transformed my life. And I'm just extremely fascinated with the changing science of allergy. So at that point in time, I decided to apply to my allergy fellowship and have been going strong since.
Wow. Wow. I like the sequence. And well, let's talk a little bit here about allergies. Can you differentiate between mild allergies, because the term allergies can be used loosely, but mild versus severe? Like, how would you differentiate that, Doc?
Absolutely. And I spent a lot of my days and time actually talking about this, Doctor. First of all, I start with really differentiating between which is a food allergy versus a food intolerance. So once we separate those two things and we're just talking about food allergy, then we're talking about the type of food allergy. Is it an immediate type or is it a delayed phase? And when we talk about allergies, we could talk about seasonal allergies. We can talk about asthma. We could be talking about eczema, and we could be talking about food allergies. But when you talk about food allergies in particular, we differentiate it by your symptoms. Okay, and so sometimes people have, and adults can have this too, where they eat a certain fruit and their mouth is just itchy. Never leads to any further symptoms. Never get swelling, never get vomiting, never get diarrhea. We call that an oral allergy syndrome, which is typically very mild. Then we have my kiddos who, if they eat a peanut, their lip is swollen and they're vomiting. They eat fish or shellfish. And we call that a severe allergic reaction, which the medical term is anaphylaxis to that food. And those are the patients I'm typically taking care of because it literally affects their quality of life and the quality of life of their entire family.
Wow, wow. So you said that the itchy throat is mild. So if you eat
For
pineapple,
fruits. Mhm.
and it's a little itchy, you can keep eating it as long as it's just itchy.
No. Thanks for the clarification. Oftentimes, when you're having, we call it oral allergy syndrome, and usually we'll say, go ahead and stop eating that fruit. But I mean, mild in the sense that is not usually leading to life-threatening symptoms of throat tightness. A lot of times, some people will have issues with the banana, and their mouth is itchy. But if they have it in a cooked form, like a banana bread, they're fine. So it's the raw fruit a lot oftentimes, and we call that oral allergy syndrome. Now, every person is different, and so we take it by case basis. Do I have some patients who eat a pineapple that lead to throat tightness? Rare, but yes.
Okay. Okay. All right. Now what causes this kind of reactions? Like someone's wondering, like, man, like I was fine before, I was doing good before, and all of a sudden H2, H3. What would you say causes these?
Yes, and that's like the age old question. Like, why do we even have food allergies? Why is it such an epidemic right now? Why is it that 1 in 13 children have food allergies? And the answer is multifactorial. It's not just on genetics alone. We have three theories right now. The one is the age old theory of the hygiene hypothesis, which states that we are living in cleaner and cleaner environments. And because of that, our immune system is overstimulated. And so when our immune system sees a peanut protein, it's overreacting. And so that's called the hygiene hypothesis. The second reason we believe that we're in this epidemic of food allergy really stems by the American Academy of Pediatrics and pediatricians like myself. We had guidelines in the year 2000 where we said milk at the age of 1, eggs at the age of 2, and peanuts and tree nuts, introduce them at the age of 3. Well, as we've done more and more research, we've realized that, really we should introduce these allergic proteins very early in life. And by doing that early introduction, which we learned in 2015 from the LEAP study, we are now able to prevent food allergies. And so the pediatricians who are training today, and many of us pediatricians, now we are really standing strong to have early introduction of allergic proteins. And then the third reason we believe we're in this epidemic is because of something called the dual allergen hypothesis theory. What that states is that broken skin, such as like eczema early in life, that's broken, when food proteins are introduced through broken skin before you've had it orally, that triggers an allergic reaction. And that's why we want to do early introduction. That's also the reason why when you see an eczema baby, it's a big risk factor for developing a food allergy.
I see. Okay. Wow. Early introduction of these foods would help almost like sensitize children to it. So it becomes more, the body, I guess, is more, the system is more accustomed to it.
Yes, and I mean 6 months to 10 months, like early, and working with your pediatrician to do that. And
Okay.
your family doctor to do that.
All right. Awesome. Now, are there things, I mean, it sounds like an obvious answer to the question. Are there things to do to prevent reactions from happening? I'll let you answer that question. It sounds like we'll avoid the food.
Well,
Um,
no, I don't think it's obvious. I think it's a great question. I'm so glad you asked because the science has changed and people don't realize there's so much more a food allergist like myself and my colleagues can do. The first things we need to identify the problem. Once you've identified the problem, there are many. We now are treating food allergy. Okay, so initially before we just say avoid it. Well, now we treat it. This called food immunotherapy treatments. And so in my brick and mortar clinic, we treat through allergy drops, which
mm,
prevents an allergic reaction. You still avoid the food, but if you accidentally should have a peanut protein, I've desensitized you so that you're not going to go into what's called anaphylaxis, which is a severe allergic reaction. We also have what's called oral immunotherapy, which both of my children have done. So my children who are severely allergic to peanut protein can now eat 8 peanuts a day through this rigorous program that takes about a year long that we can do. So there are so many things, and this is why I want to get the word out about food allergy, where previously we just avoided and grab your EpiPen. We avoid, grab our EpiPen, and now you may be a candidate for treatment. And that is life-saving for the child and for the parent.
awesome. So essentially, you're saying there are options. There are better options that
There are
allow for, yeah, because I can imagine as a parent, oh, can't touch it. You go to a restaurant, you're panicked, you're looking around, wondering, okay, what can they eat, what can they not eat, who can touch them, who cannot touch them. So you're saying essentially that there are options. This is good. So that leads me to my next question. As a parent who's watching, who's saying, I'm worried about the quality of life my child would have because not everybody's super aware of food, people's allergies. And so they eat whatever is comfortable for them in their house. And so I, I have had to avoid my child going to hang out with different people or going for sleepovers or doing this or doing that that normal kids get to do because of these concerns. What would you say to that parent as far as how can I help my child improve their quality of life and how, like, just be a child.
Just be a child. And the first thing I would say is, I've been there. I live that life as a food allergy parent, and I take care of my kiddos. So I 100% get it. The second thing I would say is there are options, okay? And I've been there in the sense like Halloween used to be a stress for me. Halloween, because now these little kids want to go trick or treating, and my kids are allergic to everything. But now, first thing we need to do is identify, is it still a food allergy, right? Milk, eggs, and wheat, 85% of children are able to outgrow it. So just because you've had a diagnosis 2 years ago, if you have not been following with a food allergist, let's figure out, are they still allergic to the food? Once we figured out they're still allergic to the food, we need to discuss our treatment options like I discussed before. Thirdly, if you're having a birthday party or if you're going to a Halloween event, there are things we need to do. Knowledge is power. Calling that host mom and trying to figure out, what are we going to be serving? I was one of those moms that when my child was going to a birthday party, I did call that mom, find out what they're serving. If I had to make my own look-alike cupcake and throw it in my backpack, I would take it and bring it. So my child didn't miss out on the social part, because as children, the social part is so important. Right now with food allergies, we are seeing an increase after the pandemic of anxiety, depression, bullying with food allergies. So it's become a psychosocial event as well. And so everything we can do with parents to empower our child, number one, to ask, what are the ingredients in the food? Planning ahead, bringing your EpiPen, planning substitutes, going out to dinner, calling the restaurant. So many things we can do, because I believe we should still have the child be a child.
Wow, this is good. I didn't think the bullying with food allergies.
Bullying,
That is so
it's
true.
real.
All right. Now, how do we address the issue of concern for inadequate vitamins, nutrients because of all the food allergies? But I mean, you've already answered some of this question because we have options now. But to the parent who's wondering, well, they can't eat this, they can't eat this, they can't eat that. So vitamins, nutrients, is my child getting enough? What would you say to that?
Yes, no, I still think it's a great question. And so one of the things, I'm very, very cognizant of that. And so one of the things when you see a food allergy, when we know you've been avoiding all these foods, that is one of the things we check, especially for vitamin D, right? It's an anti-inflammatory. And a lot of these kids who have allergies, and asthma, and eczema, and darker skin end up being very low on their vitamin D. So that's one of the things we're very quick to look at and supplement. Second thing is, there are some people who are over-diagnosing themselves with food allergies. So the first thing I like to do is to strip it all down. What are we really allergic to, and what are we avoiding but we don't need to avoid? And my favorite thing is to reintroduce food back into your diet if you don't need to avoid it. So once we strip it down and figure out what we're allergic to, then we try to find substitutes that also supplement the nutrition. And as a doctor who sees things from every angle, I also involve my nutritionist, right? You can't manage allergy without optimizing your nutrition. And that poor parent is overwhelmed with, how do I cook meals without milk and egg and wheat? And how do I cook my cultural meals that I really want to eat now that my child is? So it's so multifactorial. You need a doctor who's looking at this really holistically.
Awesome, awesome. And this has been very, very enlightening. So as a wrap-up question, Doc, I have a parent who's watching who's saying, yes, Doc, okay, thank you so much. This is very helpful, but I feel a little bit overwhelmed. I feel
Yeah.
like, it's a lot to have to think about. As a mom who and a physician and a pediatric allergist and a mom of kids who also struggle with life-threatening allergies, food allergies. What would you say to that mom if she's watching right now, or dad?
Yeah, or dad, Well, I think that wherever you are, find a community. Okay, there are, and I don't mean just any community. Talk with your food allergist. If you're in the local DFW area, I am here for you. But there are other pediatric allergists here. Look for an allergist who can help you, who's going to understand your problem and looks at it holistically. Looks at it as, how do we provide support for you as a mom and manage your anxiety, because we need to manage that so it doesn't transfer to the child. And someone who's also looking at helping you get diagnosis, and not just diagnosis and go, but who's going to hold your hand throughout the entire journey about how do you navigate this socially? How do you navigate this on the basketball team? How do you navigate this with sleepovers? How are you going to navigate food allergies? And really what I call provide food allergy freedom for the child and the parent. With us, we have a telehealth service where we talk about this and we can screen you and really discuss this. And we also have a brick and mortar in Texas as well.
Awesome. Awesome. That being said, Doc, where can people find you to connect with you, either to have you come talk to them about food allergies so you can help with parents who are in the same boat, um, or kind of come see you as a patient? We want specific, Doc.
We want
So where,
specific.
yeah, where can people find you?
Thank you for the opportunity. We are opening our practice called Texas Allergy MD. In November, we'll be opening in McKinney on Coit Road. And in December, we're going to be opening in Southlake, Texas, off of Kimball Road. So look for Texas Allergy MD. And if you'd like to do a telehealth visit, you can reach me at www.allergeniq.com. And we're also going to send a link later where you can have a special present from me to get a food allergy consult via telehealth. Thank you.
Awesome, awesome. I love what you do, and thank you for breaking it down for us this morning. This has been very, very helpful. For those who are watching live, I keep forgetting to do this. Hashtag live, those who are watching the replay, hashtag replay. Please share with those who will find this very useful. And what we're going to do at the end of the live is also put that information so people can reach out to you and get the help they need. But this has been very, very, very good. There's hope. And
yes.
there's hope that these children can live a good quality of life even with all the life-threatening food allergies. So thank you for what you do, Doc.
Thank you for the opportunity. I appreciate it. Have a wonderful weekend.
Thank you. My pleasure. All right. Thank you all for watching. Karen is sharing. Be sure to share. And if you or anyone you know is looking for an awesome, a passionate, and a thorough family physician here in the Texas area, I am she. You all have a good one, okay? Thank you, Doc.